All right. Hello, everyone. This is Dr. Joel Rosen. I am the Stress Recovery Ninja, and I want to welcome you back to another edition of your Adrenal Fix podcast. I'm here with a special guest, Dave Maconi, who is a doctor of dental surgery. He has his BS in exercise science. He also does his own podcast as well and his own YouTube channel, Grains and Brains, I believe it is. Is that what it is?
Brains and Gains.
Brains and Gains. I'm so sorry about that. And I had heard Dave talk with Dr. Kerry Jones, and that's how I found out about him. So I said, hey, he's in our space. He's in this world of research-based health and wanting to improve physical fitness and exercise. So I wanted to get him on the call, and here he is. So welcome, Dave, to our podcast, and thank you so much for doing this.
Yeah, no problem. Thanks for having me on, man.
Sure. So tell the audience and myself just a little bit about you, because I'm always interested when I see someone who has an exercise physiology or science background, because that's my original undergraduate degree. But then they go on into the healthcare model. Myself, I went into chiropractic and functional medicine, but you went into dental surgery. So tell us a little bit about your story, Dave.
Sure. So I got into this very young, probably close to 10 to 12 years old. I was an overweight kid. And so, at that age, I just wanted to look better. I wanted to have abs. So I started dieting down, pretty unhealthy way of going about it. And I got really skinny. So by the time I was 14, I was around 5'11" at that time and 130 pounds. So I wouldn't say I was like anorexic, but I was very, very skinny. So at that point, I remember my grandfather actually was like, you need to bulk up. I was like, all right, I guess I'll start lifting. So I got the Body for Life book from my dad, and I was just hooked at that point. Got really into lifting and really into the science behind it, and just started reading more and more. Came across articles, even started reading like scientific articles. And then I decided that when I went to college, that's what I wanted to major in. But the plan was always actually go to med school. So I was always a good student. I liked the sciences, so I thought med school would be perfect. But the more I looked into it, the more I heard like a lot of different doctors complain about it. I probably talked to 10 different doctors saying I want to go to med school, and maybe one of them said that they really enjoyed what they were doing. And a lot of them really didn't like it, either because of how much things have changed. Insurance is a huge issue now, and how they didn't have autonomy. And a lot of them said to go look into dental. So I thought, all right, and I started talking to dentists, and none of the dentists I talked to said to go into medicine. It was always the other way around. So it was just a different way for me to get into the healthcare field without necessarily being in traditional medicine. So looking more and more into it, it obviously is a little bit different in terms of how you're treating patients, because it's looked at, and I'm sure we're going to talk about this, how it's not always seen as a systemic thing. They almost look at it as a different area. But obviously the mouth is connected to the rest of the body. And so your oral health relates very much to your systemic health. So as I've gotten more and more into the profession, I've gotten more interested in that aspect of it.
Cool. So how long have you actually been practicing dentistry now for?
So I just finished the residency this past year. So I've been in private practice now for 1 year. And then obviously the residency was just to get some more advanced procedures.
Awesome. Okay, great. So, and that's what really interested me when I saw your interview was, okay, so Dave's probably going to bring his exercise background and his search for knowledge and research-based information into his practice. So I guess what changes have you seen with since starting now into your own practice and also with your background in exercise health and wanting to make an impact on people? How is that influenced the way you practice dentistry? Is that traditional ways, or what else? How do you provide your services to your clientele?
So it's both. I mean, obviously, the traditional person going to the dentist, they're going in for a problem, or they're going in for their 6 months. They're not necessarily thinking about their systemic health in that appointment. And so it is kind of fun to be able to educate them about how their oral health relates to their systemic health. So just as an example, there's a high correlation between periodontal disease and diabetes. And so when people get their periodontal disease handled, they tend to have lower glucose levels and lower HbA1c levels. So there's definitely a lot of correlations seen like that. And a lot of the patients don't know. There are patients who, they're pretty up on their health, but there are patients I see who haven't been to any healthcare professional in years. And so you see this chronic inflammation going on in their mouth, and there's other health issues going on. It's very rare that when I find out about their other medical history, they have a lot of issues with the mouth and no issues anywhere else. Usually there are, ties there between the two. So as far as, folks, go ahead.
No, keep going. I didn't mean to interrupt you. Yeah.
So for my patients, again, there's always going to be like the traditional patients who you just have them come in, you tell them they've got a cavity or they need a root canal or something, and that's all they want. But there are a lot of patients who are open to hearing about more than that. And it's nice to be able to sit down and be able to inform them about how, this one problem can cause more and more issues. So that's something I like to be able to sit down and talk to the patients about.
Yeah, it seems like that would be more of an evolution of Dave and his practice of dentistry, right? In terms of as you start to see the improvements that you make on the people that you involve more of the systemic or the holistic approach, especially if you yourself are a tracker of stats and do little own experiments and read the data and apply it to yourself. I would imagine it's going to be an interesting evolution of how you continue to provide your services and make somewhat of it mandatory that if they work with you, these are the things that you do to get them healthy beyond just the basic approach. But I mean, that's why we call it practice. So it'll be interesting to see how it evolves. All right. So kind of like yourself, I was very similar in that regards. I played a lot of sports at a young age, and I played soccer, and one of my coaches got us into exercise very early. So I started exercising really early myself, lifting weights, getting into the science and the research into it, and then went through exercise physiology myself. And then I hurt my back actually. And I'm from a traditional medical family. My family's mostly medical providers. My sister's a family practice doctor. My mom's a public health nurse. My uncle's a dermatologist, and my cousin's a trauma surgeon. So it was told to me that I have to go for surgery. And I was really upset, because I had an exercise physiology degree. I was a trainer. I have my certified strength and conditioning specialist, which is the top-notch one. I don't know if you're probably aware of that. That's the one where if you wanted to be a certified strength and conditioning coach for the Chicago Bears or whatever, those are the guys that have that background. And I felt, well, if I can rehab it on my own, why would I go for surgery? I was always sort of the holistic black sheep member of my family, right? So then I ended up hurting my back and rehabbing it through exercise. And I went to a chiropractor, and I was like, okay, this is what I want to do. It was sort of like a bolt of lightning. Okay, I know what I finally want to do. So I did that. And when I graduated, then all of a sudden they don't tell you in chiropractic college how really only 10% of the population utilize you, and probably the other 90% don't even believe it's a legitimate healthcare model. And so you have this whole albatross that you fight your whole life, justifying a holistic approach to healthcare. Then just to tell you my story, I had graduated with over $200,000 worth of debt. I moved from Toronto to California to Florida. My wife was pregnant with twins. I injured my back again. I just started my own practice. I was overwhelmed, exhausted, burnt out, couldn't focus, concentrate. And I had an acupuncture patient bring in a book called Why Do I Have Thyroid Symptoms Even Though My Blood Tests Are Normal? And I've heard your thyroid story. And I looked at the book and I was like, I don't need this. I don't have a thyroid problem. So I let it sit on my desk for probably close to a year, and then I finally, something pulled me over to it, and I started reading it, and I got to a section in it on adrenal fatigue. And I don't know how they got my picture in there, but they got a picture of me in there. It was like a spitting image of me. Like it was describing me to a T: exhausted, burnt out, shaky, lightheaded, and jittery, dysglycemic, potentially crashing after meals, not handling stress, anxiety, circadian rhythm disruptions, a lot of things. And it opened up my eyes like, oh, if I can have like 2 undergraduate degrees, a doctorate degree, and I've never heard of this then there's got to be something going on here. So the long-winded question is, I listened to your podcast the other day, and you were talking with Carrie Jones, and you guys were both talking about adrenal fatigue, and both of you agreed that there's no such thing, or it's not a legitimate diagnosis, or however, maybe it's not recognized. But I guess I'd like to know what your feeling is towards that actual term, Dave, adrenal fatigue. So what's your take on that?
Sure. So I think, as we talked a little bit, the problem is there's a stigma to it, and you have a lot of people who use the term inappropriately. And so I think most people would agree that, well, obviously, there's Addison's and Cushing's disease, but even aside from those, you can have issues with cortisol production, the wrong amounts or wrong timing of cortisol production. But the symptoms sometimes that people proclaim are adrenal fatigue, in my opinion, are very vague at times, and they can be caused by a host of other issues. And so I think that while there can be, you mentioned your own personal issues, and I think a lot of people can relate to that, I think we need to find a way to actually find the source of the problem rather than just a catch-all term, adrenal fatigue, which, I think a lot of people could just say that and say, I have adrenal fatigue because I'm tired, or, my sleep is off, or something. So as far as the actual term, I think maybe because of the stigma is why myself or Dr. Carrie Jones doesn't use it. Though I think we also don't think that the people are just making up their symptoms. Their symptoms are real. There's something going on, but it's maybe not what they think it is specifically, if that makes sense.
Sure, it makes a lot of sense. And I would agree with you, actually, because I've come full circle now, where I was really mad when I found out that there's this whole phenomena, which is probably a better term, a series of signs and symptoms that if you research, and I would probably say healthily OCD, in the sense that, okay, once I found out about this, like researched Hans Selye and Walter Cannon, and just go back to the history of stress theory. And even Hans Selye at the time was sort of a laughing stock of his peers, because he was saying that there's a generalized systemic response by the body, no matter what illness it has. And his peers thought that was crazy. And now that we've learned, as through his research showed that the adrenal glands hypertrophied, the thymus gland got smaller, and there was all sort of GI issues. And now when we look even deeper, which I was telling you, we see it more on a mitochondrial supply and demand problem. Just you don't produce oxygen at the demand that your body needs to, and or utilize oxygen that the demand that your body needs to. So I guess I would agree with you in the sense that it is a catchphrase, but who's to blame for that when you look at the traditional model and they have things called chronic fatigue, fibromyalgia, and these are terms that don't even give you an idea as to what the pathology is involved. Fibromyalgia, tension headaches. I mean, those aren't cluster headaches, migraines. Those are even really giving you an idea as to what the pathology of what's creating the problem too. And so it just seems somewhat of a double standard, where we can come up with throwaway diagnoses where, when we don't really know the extent of what it is, we'll call it this, that, or the other. But when you present with an adrenal fatigue problem, then we'll take real liberties with that. It just seems like, let's get some consistency here. And I would agree with you. We need to have consistency. We need to understand that it goes a lot deeper than the adrenals, the HPA axis. I told you, I think it goes a lot deeper than the HPA axis. It impacts your ability to transform hormones in the liver and the GI system. It goes into the ability of the cell membranes to be able to bind, have receptors to bind chemical messengers and signalers to be able to elicit a proteomic effect. It goes right down to the DNA level of your ability to repair enzymes. So it's a big umbrella term, which I would agree with you in that sense, in that we need to have a better workable model which really understands what's going on and how stress is impacting. That's why I call myself now the stress recovery ninja, right? Not the adrenal fatigue recovery ninja. So it's a stress problem. If we look at the stress problem, we looked at stress, there's a circadian rhythm problem. And that's really the fundamental breakdown is the circadian rhythm, which regulates all the systems in the body, is breaking down. So anyways, as far as for you though, getting back into dentistry and now also just talking about brains and gains, tell me a little bit about, are you doing some consulting still? I mean, you're doing podcasts and you're interviewing other people, and you're building your practice and you're doing research. What else do you do? So I get a little more insights on that.
Yeah, so I mean that's the majority of my time right now. Running the office, I'm the main person there, so running that obviously takes up a lot of my time. And then the podcast thing kind of started as a way, one, just because I'm interested in these areas, and so it's nice to be able to talk to other professionals. And then two, I don't know if you saw this part, but there's a charity aspect of it, and so for every podcast I do, we make a donation to a charity. And that charity is based on the choice of the interviewee. So for Dr. Carrie Jones, I think we stuck with Operation Smile. So that's an organization I work with a lot, which helps children with cleft lip and palate surgeries. But there's a lot of different ones on there. So it's just been a good avenue for me to, have somewhere to donate and spend more time. As far as with my patients, that, they know about the other stuff I do as far as, like even like interviews and things like that, but they are a little bit separate. I would say that as far as being able to treat it, it's nice because you were talking about the like the mitochondrial issues and the circadian rhythms. I would say as far as the patients go, oh, and actually sleep apnea was something else I wanted to touch on as well. So sleep, I would say, is the biggest issue that I can address between these two different worlds, between the patients and traditional medicine as myself as a dentist. So I don't know if you do too much with sleep apnea yourself. I can go into more detail depending on if you do. Is that something that
I have patients come in with that as a concern, but we do mostly like, I use the analogy, like, let's look at it as in terms of like Mr. Miyagi and Daniel-san, where we'll do like wax on, wax off. And then when you're ready to, get those basics down, then we'll tackle the fighting. So the analogy is that let's look at the basic functional blood work where we may have low-grade anemias, dysglycemias, low-grade inflammation, immune dysregulation, increased white blood cells, just all those things, Dave. And then from there, you'll see some glaring concerns. And then once you address those, then you could specifically see some improvements on other things like sleep apnea and so forth. So that's kind of how I look at it, although that's, CPAP machines, controlling glucose levels, ideal gut health and liver function. So I guess that's the most I get into it from that point of view.
Well, that's a good point though, because like you said, when you address some of those issues, they come back and they help other issues you have. And I think that's kind of the main point that yourself and Dr. Jones and other people in this space kind of want to touch on, is that it's not just about one issue, right? A lot of these issues are related. And so oftentimes if you fix one, another one takes care of itself. And I would say sleep is a big thing, that when people correct their sleep and they finally get into a good rhythm, a lot of the other issues they have do kind of correct themselves as well. And that's probably one of my main issues, I would say, with traditional medicine, is just in the sense, and don't get me wrong, like I think there's a lot of good things in traditional medicine. But one thing I think is an issue is, one, focusing on one specific problem or one, and not looking at the whole body. And two, not necessarily being open to different options. So we talked about evidence-based, right? And I do understand there are certain, even legal reasons why you have to have a lot of evidence before you can make a recommendation. So my thoughts on it are, if we have clear evidence against something, like very clear evidence against something, then I wouldn't recommend it. But if something is still just kind of up in the air and a patient feels that this legitimately helps them, then I'm more okay with saying, you know what, I'm not going to tell you that you're wrong if you're saying that you feel a noticeable benefit from it. So I think that being able to view all of this as a whole is really helpful, rather than just specific one issue, because they do in general tend to relate to one another.
Oh, absolutely. And that's what I was telling you a little bit earlier, where I do a lot of consulting all over the world. And I've seen, I don't think it's unfortunate. I think it's fortunate. The higher my antenna goes and the deeper I go into my research, the more difficult the patient base is, right? Because you just, that's the way the law of attraction is. The more you know, the more you get things that someone above tells you, okay, you don't know it all. Like, I got to learn more now, right? So with that being said, they'll, have their arms crossed. I can just feel it. I don't see them on the other end of the call when I'm just discussing what's going on. And like, I've tried everything, and this, you're not going to tell me anything that I don't know. And nothing works. And what is it that you do that's different? And I was talking to you a little bit earlier about real-time data. And I think that one of the other goals is to have a paradigm shift in healthcare where, unfortunately, like you said, with evidence-based research, that there's a time delay too, where you get approvals to try drug trials or to be able to get. So by the time that actual research gets published, it's 17 years on average down the road from when it actually first got conceived, right? So there's a whole delay there. And really the goal is to disseminate the information into the population as quick as possible. That's where the real-time data tracking comes into play, where I was telling you, where you have these devices where you can do the Keto Mojo and you can do your ketones and glucose. And there's now a great research article by Dr. Seifried out there in terms of gliomas and the relationship between that and fermentation of glucose and utilization of fermentation with the presence of oxygen, where that's how cancers develop. So they look into keeping a 2-to-1 ratio millimoles of glucose to ketones, and that being the metabolic flexibility zone where you can have really great energy production and really great immune dampening and improvements. But back to with the data tracking, you can data track your glucose, your ketones. It will upload to a reporting site. You could bring in your blood work into that site. You can look at your chronometer and your calories and your protein, your carbs, your fats. You can look at a fitness gadget that measures your steps, your activity levels, your heart rate variability. And what you can do is you can now do real time. Like if I have coaching clients, let's say I have 50 coaching clients, I can actually do a whole, study the data, and I can start to see real-time values. Hey, like the obvious, when you eat way more carbs, your glucose levels go higher, right? And your ketone levels go lower. But now I'm seeing non-obvious stuff like, hey, when you actually eat less than 80 grams of protein, but more than 50 grams of protein, you see that your heart rate variability is in a better zone here. Or you can see that when you have a certain amount of activity, you have a certain amount of calories, certain amount of fat, certain amount of proteins, your ketone levels and your glucose levels are in the zone, your heart rate variability is the highest, and that's a reflection of your, and then you can implement that right away. It doesn't require 17 years of research, data. So I think that's where we're headed. And I guess that's one of the other reasons I wanted you on the call too, because, I was listening to your podcast, and you're of that mindset. Well, hey, like I test my stuff, and I found when I did ketones, my GI health, it said, so stuff like that, where you're actually inquisitive minds want to know, like, can I do things proactively today, and will that make a difference on my overall health? So that's another goal for me as well, is to get empower the patient and have them understand you are not necessarily your blood work, because a lot of the times they're falsely negative. And if you were to be compared to a really healthy person, like you are when you first get approved of a good health plan, you would fail a lot of grades when you're getting compared to what your markers are, when you're being, versus being compared to unhealthy people, or the average of the people that took the lab the year before who aren't necessarily healthy. You're being compared now to an unhealthy population. And if you're not sicker than them, you're told you're normal, and normal doesn't necessarily mean healthy. But at the time of getting the insurance policy, you weren't compared to them. You were compared to really, really tightly controlled, healthy population, so that as an actuary table, I know that I'm going to have better investment with someone that is not going to die on me, in terms. So anyways, I think that healthcare is interesting, and there's a lot of different ways that you can go. But as far as what I want to talk with you about is some of the concerns that I see with really difficult cases in my practice with exhaustion, fatigue, beyond just glucose problems and stress, are big problems with heavy metal toxicities and immune dysregulation. And a lot of them can be from doing a try test with hair, urine, and blood and seeing high amounts of mercuries or aluminum or lead or cadmium, or even from cavitations too, from old wisdom teeth extractions that weren't necessarily disinfected, and they continue to harbor pathogens. So I guess I wanted your take on that, because I know it's a bit of a controversial subject. So I guess maybe talking about first, we talked about your feeling about the amalgams and the problems with potential mercury fillings. What's your take on that?
Sure. So I'd say the two controversial topics in dentistry versus, I guess, like holistic medicine would be fluoride and mercury in the amalgams. And so for me, again, just talking about what I've seen in the evidence, I'll start with fluoride and then we'll go to the amalgam. So for fluoride, a lot of people will talk about how they think well, let's first talk about dose, because for anything, the poison is in the dose, right? So certainly high levels of fluoride are not something that you want in your body. However, if you're talking about brushing your teeth with a fluoridated toothpaste or something like that, the reason that we say it's beneficial is because your teeth have what we call hydroxyapatites, right? And so the critical pH of enamel, that's basically when it will start to dissolve, is a pH of about 5.5. So when you have fluoridated water, fluoridated toothpaste, something like that, you actually have a replacement of the hydroxyapatites with fluoroapatites. And the critical pH of those is around 4.5. So for people who don't know, a lower pH is more acidic. So that means that it can tolerate more acidity. There was a recent study, I think they were showing, there was even an area in Canada where they had taken away fluoridated water, and caries or cavities basically went up about 35% in a year. So it's pretty significant. And from all the research I've seen, the amount that we have in the water has not been shown to be problematic. So, I mean, I'm certainly open to hearing about other data, and maybe you have some other information that I'm unaware of. But so far what I've seen is that it's pretty beneficial, and that the communities that don't have it have a lot of dental issues down the road. And, talking about the bacteria that mainly causes cavities is Streptococcus mutans. It's a gram-positive anaerobic bacteria. And that same bacteria has been found in atheromas, so like plaques that can lead to heart attacks. Even when hearts have been taken out and they've looked at the plaques, that's what they found there. So pros and cons, you have to look at the benefits. Is that something that you want harboring in your mouth, all of this extra bacteria that you're swallowing that's going to other areas of your body, if you could have something that shouldn't really cause a lot of risk and has a lot of benefits? So I don't know if you want to say anything about fluoride in your opinion, but
yeah, I mean, listen, I appreciate what you're saying. I do have some other access to articles that I can't quote right now because I don't have them here, but I'll look at them again and maybe I'd have a better rebuttal for you. But there's a certain amount that I understand what you're saying. The way I would look at it though is kind of like the cholesterol argument, where it's not the cholesterol in and of itself that's the problem. It's the inflammation with the cholesterol. And here we are so many years later, and cardiovascular diseases have not gone down. If anything, they've gone up. So the problem with the mindset of giving cholesterol lowering medication is it's really short-sighted in the terms of what was the cause in the first place. And the same thing I would say is, what was the cause in the first place that lowered the pH? It wasn't from a fluoride deficiency. It was from immune dysregulation, low, breakdown of secretions, oxygenation to the cell, cell danger responses, mineral deficiencies. And I just think that there's a broader picture from an integrative approach to address the small stopgap that is overly ambitious to address all those issues. Does that make sense?
It does, yeah, and I would agree as far as like statins go. Certainly, there are a lot of issues with statins. You know, if you want, we could touch on that. And people, I think anybody who is taking a statin should be looking into something like a CoQ10 or ubiquinol supplement. But you know, that's another rabbit hole. As far as the amalgam fillings, so there's different forms of mercury, and certainly mercury poisoning is a real thing. It is something that you have to be cautious of, especially if you're like a pregnant woman or something like that. But even for general population, you know, we've seen real mercury poisoning cases, even from people who are having too much tuna fish. So it exists. One thing I would say is I have had some patients ask me to remove their amalgam fillings and replace them with a composite filling. So two things about that. For one, you need to educate yourself, because these people, they will hear, I want this metal out of my mouth. But do you know the composition of composite? Do you know what is in there? Because they will just kind of blindly think, well, I'll just put this other thing in my mouth. But just like amalgams, there are, you know, it's a chemical structure. There are other things in composites. So are you comfortable having that in your mouth? Just something to consider. I don't think many people realize that you are taking something out, but you're also putting something else in that is also, you know, formulated. Secondly, you have to consider that the exposure that you would have to any mercury when you're removing those amalgam fillings is potentially significantly greater than if you were to leave it in its already hardened form in the tooth. So, you know, that is something that I've seen people say, I just want this out. And I ask them, how was it done? And they say, oh, well, the dentist just drilled it out. Well, then you just swallowed a lot of mercury and all that in one dose. So, while I personally haven't seen too much good evidence that the amalgam fillings cause any legitimate issue, and I think maybe we might disagree there, I will also say that if you do believe that they cause an issue, consider that if you're removing them, you are having all that particulate matter potentially going down into your body.
Yeah, and not only that, because I know you've interviewed a lot of guests with the genetic SNPs and nutrigenomics, and I do a huge ton of that. I mean, I've studied really, really hard on that, and so a lot of people will find me, and that's how a lot of my business is that, hey, can you review my DNA, my ancestry, or my 23andMe? And you could really see how a body susceptibility-wise is set up to be able to clear out metals, and to be able to recycle and make glutathione. And really, from my understanding, is number one, the problem a lot of the times with those composites and the amalgams is that there's different metals in there. And so if you've gone, you know, with different metals and different teeth, it's kind of like a battery, you know, because you have these dissimilar metals in your mouth that, you know, you have dissimilar metals in a science experiment, and it creates ions and charges that are never good anyways. But on top of that, I've learned that from some of the research I've done is to number one, get dissimilar metals as similar as possible, first of all. But from a genetic standpoint, I would be really interested in understanding this person's susceptibility, because when you do, even if you don't drill directly into the tooth, and you do it in quadrants, and you have a rubber dam and a filtration system and an HVAC, so that you minimize all of that possible swallowing and so forth, and you're proactive in knowing what composites you want to put in there that you feel or has shown some of the research to be less deleterious, then I still want to make sure that that person has their foundational antioxidant system on board, in lieu of the fact that their genetic susceptibilities will really cause, when those amalgams are pulled, a somewhat dumping of any of outgassing nutrients that were held in suspension by all of that extra load of amalgams in the mouth. So that's where it's really important, where before, during, and after, in a lot of the, a good buddy of mine who teaches Organic Dentist Association and the IAMOT societies and stuff like that, how to go about looking at methylation support, glutathione, liver binders, so that you minimize any bad impacts that you'll have from the actual procedure alone. But I would agree with you as well that you can be creating a whole other problem with the removal process than the actual problem that you had with the amalgams in there. Sometimes you just want to let sleeping dogs lie, so to speak, and not have an immune system that gets triggered and that's undermanned when you create that negative deficit. Does that make sense to you, or how do you feel about that?
Yeah, I mean, I'd actually be interested if whenever we get off the call, just send me some of those papers that you've seen. Because like I said, I'm always open to research. Just from what I've seen, I haven't seen too much showing true problematic issues from the amalgam fillings that they've really been able to directly associate. But like I said, I'm always open. If there's legitimate evidence out there, I'm happy to see it. Yeah,
well, listen, and that's what I appreciate about you. And I like the fact that you want to do the best you can, and going with the research is your best bet to go with, right? Because that's what's controlled and studied and so forth. But I would just say that I think that, and I don't want to go down this rabbit hole, but with the ADA, there's so much, CYAing based on, stuff that's already been done that you can't really have published research. Anyways, I don't want to go down that rabbit hole. As
Sure.
far as, as far as the, what's your thoughts on cavitations and not properly disinfecting and neutralizing? Have you seen that yet at all on your radar, in terms of many years later, you have people that have really, really bad mitochondrial health, like they're exhausted, burnt out, tired, they're not producing ATP, and a lot of it can be as a result of cavitations. What's your insights on that?
So it's hard to say in my own personal experience, just because I don't have, decades of treating patients to see how the outcomes of that treatment. I would say the biggest thing I see is correlations. And so just going on that, kind of touching on what we said before, in general, the patients I see with the worst oral health and the worst treatment that they've had of that oral health, the worse everything else in their body seems to be. Now, can I say specifically that's due to a mitochondrial issue? I can't, but I would say that, from what you're telling me and what you've seen, and I know you're pretty confident in that regard, I would say that in general, though, the patients who I see with the worst systemic health have the worst oral health, and vice versa. I think we talked a little bit about the periodontal issues and what that can lead to. Certainly strong correlations with almost every other disease that you can think of. And I think when you see people who have one area of deficit in their health, that tends to, is that a cause of it, or is it just because this person doesn't take care of their health in general? But like I said before, when you actually look at the bacteria that's involved, there are specific exact correlations there, where this area is actually found in another part of the body. Even as, kind of a tangent here, but a study at UNC recently just showed that women who had periodontal disease were 7 times more likely to deliver a low birth weight preterm baby. So just, it sounds like why would that even be related? But there's just correlation after correlation is found that leads to systemic issues. So I can't necessarily say what you were saying about the specifics. But I would say that when I see areas like a lot of cavities, things like that, it does seem to correlate with other systemic issues.
Yeah, it makes sense. Like where if someone's going for an extraction because they have impacted wisdoms coming in, but they're a unhealthier cohort, then they're more likely to have problems down the road than the ones that were healthy, that had their wisdom teeth removed, and now they're dealing with a longer term problem. But when I work with, like I said, the deeper I go, the more difficult and challenging the cases are, Dave. And you do the workup that you do, and you're still like scratching your head, like something's like, we're missing something. I know it, we're missing something. That's where I believe the oral care comes into play hugely, like especially like it's a breach of your immune system. Like if you have periodontal disease, then that's where sort of the broken pipe is, right? That's where the smoking gun is a lot of the times with the people that I'm working with. So what would be some good, just take home recommendations, knowing, okay, oh, wow, I didn't realize that my exhaustion, my fatigue could be as a result of, the status of my mouth, right? Like, so, I mean, common sense stuff, but with a spin of, brains and gains on it. What would you tell the average person that now is sort of, hearing this, and what can they possibly do, to really maintain proper oral health?
Sure. And it's funny because, you and myself, we get into these rabbit holes and we get into these details, right? And everybody else I've interviewed too, we talk about these really specific details. But if you actually kind of step back and look at it, we probably wouldn't need 90% of doctors if everybody ate well, slept well, exercised regularly. And the reality is we just don't, right? Not everybody does. But if they did, tons of our problems would go away. And it's kind of the same thing with oral health, right? We can get into, this specific treatment and advanced technology we have and all these different things. But at the end of the day, 90% of the problems would be taken care of if people just did what they know they need to do. Brush your teeth, floss, not a lot of sugary drinks, which obviously would have other, systemic issues, things like that. So it is, like you said, it is kind of common sense in a way. It's just things that a lot of people don't do. You see, I'm sure some of the clients that you have around the world, you see them and you think, if they're just not even doing the basics, right? And so they have all these issues and they're trying to hone in on these specific things, but they don't even have their sleep right, or they're not even just doing basic exercises, right? So it is pretty straightforward, I would say, is, see a dental professional, don't just try to take it into your own hands. But obviously, brush, floss, things like that. And then a little bit what we talked about before, one of my fun topics is sleep and people who have sleep apnea. That is something that I get to help treat, at least with different oral devices. And obviously, poor sleep correlates with tons of issues. I mean, just every study that comes out on it shows people who are getting inadequate sleep have chronic systemic issues. So that, to me personally, is something I like to be able to treat in my practice as well.
Yeah, if you're willing, I'd love to do a part 2 on that, because I think that could add a lot of value to my listener base in terms of the sleep apnea. But I would agree 100%. The more you get caught up in the weeds of the research and the genetics and the SNPs, and the more you realize, okay, your stress and your life drives this in the first place, right? I use analogies all the time, and my analogy is, when you have a homozygous SNP, your mom and your dad gave you both copies of an altered gene. That doesn't mean it's broken. It just means that it has a problem transcribing it. So almost like an old credit card processing machine, where you put the card in, it swipes over it, it creates a transparency, and you have another copy. That's the analogy I use, that when you have a plus where both parents have it, the card goes in sideways, and for every 2 or 3 swipes, 10 swipes, only 2 or 3 come out that are good. And that's going to be a problem when you need to process sales for your company. When you're having a sale, if you don't ever get a good credit card, you're never going to have any money in the bank account. The analogy I use is, if you're not copying an enzyme that's important for making a nutrient that's important for regenerating your DNA bases, or making your neurotransmitters, or repairing your cells, or making antioxidants, then you're going to have problems. But the analogy is such that the other analogy I use is like a highway, where every double SNP or plus homozygous is a 2-lane highway when it should be an 8-lane. And the heterozygous from either mom or dad, but not mom and dad, is 4 lanes. And then if there's no SNPs, it's 8 lanes. So it's going to travel quicker. But most people will say, well, then I guess it looks like I don't have a problem at this highway because it's minus. And I tell patients, well, there's cofactors too. So if you have, say, you're on a highway that's a paid toll, and you don't have a change or a transponder, you're not going to be able to travel on the toll. Or you could have a lot of cars, the Super Bowl's emptying, and you got massive traffic on the highway, and it doesn't matter if it's 2 lanes or 8 lanes. It's just not. And the cars is the analogy of stress. If you just got stress all over the place, it's going to impact your highways. And then lastly, car accidents. Car accidents will impact highways, where car accidents could be medications, heavy metal burdens, glyphosates, infections. Those are the main things that slow down the highway. So I tell patients, really, you can study the widths of the highways, which is the genetics, but you can't do anything about it. I can't be Adam Man and go inside your DNA and make your highways bigger now and give you different enzymes, but I can impact the debris from the car accident. I can impact the amount of cars on the highway, and I can also make it available so that you have cofactors so that those highways work better now. And that's all, like you said, common sense stuff, right? That's all lifestyle stuff. So as far as reaching you, how do people get in contact with you, Dave? From your websites to your podcast to your YouTube channel, what's the best way for them to get in contact with you?
Yeah, so on drdavemaconi.com, there is a message form there if you want to reach out to me. That just goes to my email. And then you and I connected through Instagram. People can message me on Instagram too. That's fine as well. And then, yeah, the channel on YouTube is Brains and Gains.
Okay, and so I'll put the notes underneath this and when I post it, but just for those that are listening right now and want to get the information, how do you spell the name so that they can get it properly?
My name or the YouTube channel?
Yeah, your name for the for your website.
Website. Yeah, so it's just DRDAVEMACONI, Dr. Dave Maconi.
Perfect. And then what I like to do is I like to ask sort of a common themed question with each guest just to get their take. And you're still young, so usually I ask, hey, what would you have done differently now that you know what you know now versus what you knew then to impact your health or even your stress response or even your adrenals or whatever you want to call it, just your optimal health so that what would be the best advice in terms of now that I know this, I would have done this differently so that I would have ultimately been healthier?
Sure. And yeah, even though I'm younger, I think just having gotten started so young, 10 to 12 years old, I think I can provide some insight there. And so for me, it was more of a stress thing and how obsessed I was. And so I know everybody listening is very in tune with their bodies and they want to learn more about how they can, improve their health. I would say though, for me though, it was because I was so dedicated at such a young age, that stress probably did more harm to me than good. I mean, literally it was at the point that in high school, I wouldn't go out at night with friends because I was obsessed. I had to have my right food and I had to get up at 5 a.m. and go to the gym. And that's probably the only thing in this whole journey of mine that I really regret is just being obsessed to the point that it almost made me neurotic and it took away from life experiences because, we're all trying to live as long as possible, but if you're not enjoying life to some degree, and what's the point? And so certainly not a ticket to just, throw caution to the wind. But I would say just focusing on stress reduction and focusing on real ways to add this to your life rather than making it your entire life.
Yeah, that's good insight. I have a term that I actually patented. It's called reducing your stress footprint, kind of like your ecological footprint where less is more, right? And it's like, I don't know if I don't play golf very much. I had in the past, but I remember someone telling me, swing the golf club slower and don't swing it so fast and really work to slow down the swing. And sure enough, you do that, the ball goes a ton further, and I kind of think that's what you're saying is that if I would have taken the time to smell the roses and not been so hard driven, I don't think I would have impacted my stress response system the same amount that I did. And I still have a lot of time to make tweaks to that so that I hit the ball further without swinging quite as hard, metaphorically speaking.
For sure.
That's awesome. Well, listen, I really thank you for getting on the call, Dave. I really appreciate it. I'm really interested to hear how your journey goes because I see a whole practice that you have no idea yet which way you're going, just because the fact that you're new to practice and you bring a lot of passion with your desire to help people. And that's true. That's obvious. But with what you're doing with charities and giving your time, and also, you bring a whole element of exercise physiology and data tracking and also evidence-based research to it. And if I lived near you, I'd come and see you as a patient myself. So thank you so much for being on the call. I really appreciate it.
Happy to do it, man.
All right. Take care.